Well, hi everybody. It's Kim Bergen-Jackson with you today. I'm the administrator at Oak Knoll, and it is November 30th. I'm taping on Tuesday. For you to see on Wednesday, when you see this, it will be December 2021. It's hard for me to believe. This year feels like it went fast to me. Feels like it flew by. And can you believe that we are 20 months into this global pandemic? So of course I'm going to update you on COVID. Johnson County, unfortunately, the numbers continue to creep up slightly, ever so slightly. So I think Steve reported last week the number was 10.3, and of course they haven't updated it yet today, but that's the positivity number. So higher than I would like it to be, about double how, I'm pretty good at 5%, but 10% makes me a little nervous. So when I talk to public health about those numbers, they really account for a lot of children becoming positive, but not severely ill. So I think the response we're having since vaccination is probably a little bit different. Oak Knoll is, of course, still COVID-free, and I'm hugely grateful for all of your efforts, and would encourage you to keep wearing your masks, even though you and I are both done with wearing those masks all the time. We have to give the masks a little credit for keeping us healthy. So I would just recommend wear your masks inside and out, except when you're eating. Try to avoid large crowds, so no concerts. If you can avoid it. If you are in a concert, outdoors is better than indoors, and the weather's been amazing this week. So if you are going to gather with people and you can crack the window and you feel okay with that, it's better to have some outside air. Social distancing is still good. Hand hygiene is still good. Covering your cough. All of those things are working for us. I don't have to tell you to get vaccinated because you're awesome and amazing and you've already gotten vaccinated. I don't even have to encourage you to get the booster because most of you have gotten the booster. There's just a few people who missed the clinics and haven't gotten into their doctor's office. So we are going to offer another vaccine clinic, and I'll let you know about that information in December as soon as I have it. We have to get some things organized first. So we'll offer another booster clinic or influenza if you didn't get your flu shot. So, hands up to the vaccines that we have available to keep us from getting sick. If you could, make another pitch to your family. The vaccines are available for everybody ages 5 and up. The boosters are available for anybody over the age of 18. And so we really need to stay vigilant with our vaccines. And Johnson County is better vaccinated than some counties, but we could all do a little bit better, I think, to get vaccinated. And that will lead me into my discussion on this new variant that I know is causing everybody some stress and worry. So Omicron is the 12th variant or iteration of this virus since it started 20 months ago. So it's the 12th one. It is the 5th virus variant of concern. So we've done this 4 other times. So yes, I know that it appears to be quite a few more mutations, particularly on the spike protein. But there's a lot we don't know about this vaccine. I wanted to say what I do know and what we don't know. So we do know that it was identified first in South Africa. That doesn't mean it's limited only to South Africa. And as we know now, it's spread quite easily by travel, and it's in a number of additional countries at this time. I think it was identified in the middle of November, so we don't really have a lot of time yet under our belt, but I can say with confidence that there have been no deaths related to this variant yet, and there have been no severe hospitalizations due to severe symptoms. And so I would just like everybody to take a breath and realize that the media blitz right now on this variant is just everywhere. And that increases anxiety, how we portray the news. And so be patient. Dr. Fauci gave several interviews over the past couple days saying that we really need 7 to 10 more days for the scientists to gather more data so that they can make some decisions. So we don't know anything really about this particular variant. It could be nothing. At the same time I say that, I want you to know that we do know that there's a possibility that the vaccines might be less protective. Reinfection might be a greater possibility. Those are all maybes. But what I'd like to tell you today is continue to set up your plans for the holidays, but set up those plans in a more safer way. So if you were going to meet 30 people, plan to meet 15 instead. If you were going to meet inside with no ventilation, make plans to open the windows. If you can meet outside, that's great. Things like that where you can identify ways to be safer but still celebrate the holidays. Hanukkah started 2 days ago. We're rolling into the Christmas season. It's just a festive, joyful time of year, and it's been so restricted for the past 2 Christmases. So I don't want you to jump to the conclusion that you can't have your holiday celebrations. You can. We just need to be smart about it, and we need to be careful. So before 2 weeks is up, we'll have more information. I trust the scientists in South Africa are working as fast as they can, and they notified the rest of the world as soon as they knew, and so they have a lot of credibility for what they're trying to do. And as it's identified in the different countries, they're all working on it too. So just remember, there's no severe symptoms, no deaths in this variant. And so I just want you to continue doing what you've been doing for 20 months. You know now how to fight this virus. And if it turns out that the vaccine is less effective, then they'll figure out how to make it more effective with a different booster or something. I don't know what they'll do, but I think we're ahead of the game. And as you know, viruses just continue to mutate. So as long as they're out there, they're going to continue to change, because that's what viruses do to survive, right? They change so that they don't go extinct. So endemic as opposed to pandemic is what's happening. So continue to plan for the holidays. We'll continue to plan for a big meal. We'll let you know about what Bruce and Dining Services is doing for the Christmas holiday. I did want to let you know that they served over 450 people for Thanksgiving in various different ways, pack-to-go meals, the Hayden room, and then room trays. Oak Knoll East had a wonderful family-style meal. Just all kinds of good things going on for Thanksgiving, wildly successful. So stay positive. Let me know if you have any questions or if you're anxious about anything. And I'll be sure to let you know as soon as I have any updates. So take care, and I'll talk to you in 2 weeks. Thanks.